travel insurance webinar. We hope to educate you today. I'm going to do some introductions in a moment. I hope you like our humor here. So just a couple of housekeeping things before we get started. We're going to try to keep it to an hour, respect your time. We're going to take your questions at the end. If you want to ask a question, just to keep, because we're going to have a lot of people on with us, we're going to ask you to put your questions into the chat, and you will be able to access the chat by clicking, it's right at the bottom of your screen in the little control panel there, right in the center, right in the middle of that bar. So locate that and open up your little chat window so that you can send a message to us, and we will get to your questions at the end. We will be recording this for use later. So just so that you know that, and copies of our presentation will be available also later. And just a final note that if you want to say anything at all during the meeting, you'll have to type it in the chat. There's going to be too many people to have an open forum here today. So, and I think that is everything in my housekeeping items. So we will get started here. Just a couple of jokes here. I don't know about you guys, but this is how I feel. I can remember getting through an entire day without taking a picture of anything myself. So the agenda for today, introductions. There's 3 of us here from Medi Quote, and I'll introduce all of us to you. And just the thought of traveling during the pandemic will be one item to discuss. COVID coverage, obviously that's one of the main reasons why we're here. And then actually how to get to where you're going during the pandemic. And then we'll take your questions at the end. So type them as you think of them in the chat, and we will get to them at the end. Okay, so about me, my name is Laurie York, and I have worked in the insurance industry my entire career. I worked at a travel insurance company for 5 years before I joined Medi Quote. And I joined Medi Quote in 2005. I can't believe I celebrated my 15th anniversary this year with Medi Quote. So been doing this a while. So I'll be the main presenter here today. Next up is Pam. Pam, do you want to give us a wave? Excellent. Thank you. So Pam is a senior broker with Medi Quote as well, and she joined Medi Quote in 2010. So she only has 10 years of experience with Medi Quote only. So she is a senior broker at Medi Quote, and she also trains our new brokers at Medi Quote. And then we have Matt. So Matt's there too. If you want to give a wave, Matt, he is the IT and marketing team leader. He joined Medi Quote in 2010 as well. We took out all the relics for you guys. And he sends out our newsletters, updates our website and stuff like that. And he's going to make sure everything runs smoothly with us for us today. So we're really glad you guys could make it. Just a word about Medi Quote. So Medi Quote Insurance Brokers has been around for quite a while. We celebrated our 25th year in business about a year ago, and we specialize in travel medical insurance. So we, this is all we do. I can't, me and Pam, we can't sell you like a homeowner's insurance or any other type of insurance. This is the only type of insurance that we do. Now there's different travel medical insurance products that we deal with, but nothing other than travel medical. So traveling during the pandemic. So it all started on March 13th, 2020. That was the day that the government called the travel advisory. Some of you will likely have been in the US at that time, and so you had to make your way home at that time. Here we are 9 months later, and the government travel advisory is still in effect. And with this travel advisory, this affects the way that insurance policies, at least insurance policies from the past, and I guess now as well, deal with COVID coverage on regular insurance policies. So we're going to get in depth on that and how that works a bit later. But that is, kind of the main reason why we're having this discussion today. So even though the land border is closed to everybody other than essential travel, air travel is permitted during the government travel advisory. I don't exactly know why that is. I can't quite figure out, why, although I read an article just today about how the government can't really stop Canadians from traveling because it's our constitutional right. So I guess if that rings true, then that will be why they're doing it. So that was just something I read today. The problem with the land borders being closed is that lots of snowbirds drive down south, and that way they can have their cars while they're down there, and that can be a little bit on the challenging side if you can't have your car down there. So just a bit of information here about flying during the pandemic. So Air Canada, this is an Air Canada website that we have access to, and Air Canada has gone to great lengths to convince Canadians that it is okay to travel, it's safe to travel. They've got new branded clean care sanitization that they use on their planes between flights and stuff like that. So they're trying to convince us that it's safe and healthy to travel. They also have flexible booking options. As if you have ever taken a flight before, you'll know that normally you can't change your flights unless you pay a fee, or you can't cancel without losing your money. I think lots of people lost money in this whole travel advisory thing. And now they're allowing that at least a little bit more freely. So they're trying to convince us to travel. WestJet is also trying to convince us to travel, and Air Canada as well as WestJet are providing COVID-19 travel insurance at no charge. So again, we could click into these websites, but these websites basically list all of the information regarding the COVID-19 travel insurance that they're providing, and we'll get into some of the details on that. Sunwing also has COVID-19 coverage that they're offering for their travelers, and it says that it's no additional cost on all flights and vacation packages on their website. I took this as a little screenshot from their website, but when you go to that link, you'll see that there are some restrictions. So it says the maximum is 200,000. It's only available for a maximum trip duration of 22 days of travel. So basically, if your trip is more than 22 days, then it's not covered. And that's kind of also the way that WestJet's and Air Canada's coverage reads as well. So the airline coverage, the positive is that it is free. You don't qualify unless your trip is 21 days or on Sunwing 22 days or less. And in all those instances, coverage is limited to $200,000 Canadian. So not a whole bunch of coverage there, but there is some. So it's not really for the snowbird or for the long stay market, but it does get some younger people interested, I'm sure. I saw this article as well the other day, and basically it's outlining that Calgary Airport have, I guess WestJet and Air Canada out of the Calgary Airport have entered into an agreement with Hawaii so that Canadians who get a COVID-19 test before they depart will be able to travel to Hawaii without quarantining. So, they are making an effort to accommodate the needs of travelers and the need to keep everything safe for everybody. here's an article for people who are traveling to the US and shipping their cars. So they're shipping their cars and then they're flying to the US to pick up their cars. And, you know, again, just getting, you know, just having a little bit of creativity here on how to get to what they want to do, which is go south for the winter. This article was interesting because it was called Border Loophole. So again, Canadians shipping their cars to and RVs to the US and then flying to meet their car. The other thing I heard just recently here in the last couple of days is that there's the Canadian government has devised a new phone app called ArriveCan phone app. And this little CTV news clip here was talking about this phone app. And basically, when you get back to Canada after your trip, you're going to have to quarantine, and the quarantining is going to be monitored, and you can you have to download this app and give them information about your quarantine plan and all that stuff. So that I downloaded the app onto my phone, but I haven't created an account and logged in yet. So that is will be of interest to those people who are going south as well. So once you know how you're going to get there, then you need to decide how much COVID coverage is enough for you. So we are going to be putting a link in the chat area so that you can take our poll. So if everyone wouldn't mind just clicking on that link, and Pam, are you going to put that link up there?
I don't have the link, Lori.
Oh, maybe Matt can, I think Matt has the link. So we'll get that link to you there. You can think about how you feel about how much coverage is enough for you. Like those airline policies are 200,000 Canadian, I should add. And if you had $200,000 Canadian of COVID coverage, how would that make you feel? There it is. So if you just click on that link that Matt just posted there, then you can vote as to how much you think would be enough coverage. And then we're going to look at the results of our voting. So we'll just give you a minute or two to do that. I just need to share this new window here, and so let's see the results. Okay, so there are the results. So 33% of you have chosen the $1 million. 25% of you have chosen the $500,000 maximum. 24%, sorry, my screens are a little weird here. I've got to take a look at my screen behind my screen here. 12% of you, 2 votes for 5 million and 0 votes for 0. Isn't that interesting? So yeah, $1 million is probably a lot better than 200,000 for coverage if you should require, you know, hospitalization or you know, whatever you might require when you're traveling, and if you should happen to get COVID. So there are a small contingent. So we've been selling, we're going to get into this in a minute here, but we've been selling COVID coverage since about the beginning of September. And you would be surprised that there are a small contingent of people, not represented in this webinar, mind you, but there are a small percentage of people who don't care that they don't have COVID coverage. So interesting. Okay, so I'm going to go back to my first screen here. Sorry, need to click the button here. There we go. Okay. Okay, so there you go. So $1 million is good, $2 million is better, but you know, it's much better than the $0 or the $200,000 option. So I would agree with you for the majority of you guys. So how much does COVID coverage cost? We get that all the time. That's mainly the reason why people call us, is they're looking to find out how much COVID coverage will cost. So what we know about travel insurance, because we have done this for a long time, we know that people compare this year's travel insurance cost to last year's travel insurance cost. So I can tell you that COVID coverage is going to be about 10% surcharge, and that is true. But the reality is that it's 10% on top of, typically travel insurance goes up basically by the cost of US medical inflation. Sometimes it goes up a little bit more than that due to extenuating circumstances, but at least at the amount of the US medical inflation, it goes up every year. Plus, you could move up to the next age bracket if you have a birthday 65, 70, 75, 80, that always moves you up into the next age bracket. You may have had a worsening of your health, which will cost you money this year. So all of those things could impact your cost of travel medical insurance. And then, of course, the COVID coverage is on top of all of that. Okay, so we are going to talk about the frequently asked questions for COVID coverage. Now, some of you already have an annual plan that you might have paid for months ago that you haven't been able to use a lot in the last few months, last 9 months really. And so we hear a lot from people, can I use that? So in order to be able to figure out if you can use that coverage or not, you really have to know what the exclusion for travel advisories say. So there's typically 2 types of exclusions regarding travel advisories. So you need to know which one your policy has. So you have to dig out your policy booklet first of all. So the first type of wording regarding travel advisories is the wording that basically says that if you're traveling during a travel advisory, that anything relating to that travel advisory is not covered. But if your travel advisory is issued before your departure date, then nothing is covered. So that's what this one says. So let's read it together here. Your travel to a country, region, or city for which the Canadian government has issued an official travel advisory, which is in effect right now, to avoid all travel or avoid all non-essential travel regarding the country, region, or city of your destination before your departure date. If the travel advisory is issued after your departure date, this exclusion does not apply to claims for an emergency or a medical condition unrelated to the travel advisory. So that last sentence here, if the travel advisory is issued after your departure date, this exclusion does not apply to claims for an emergency or a medical condition unrelated to the travel advisory. The problem is that right now a travel advisory is issued. So if you depart, the travel advisory is issued before your departure date. So nothing is covered. So it's a bit of a backwards way to say nothing is covered. So that annual plan is actually not any good to you until the travel advisory is lifted. Hopefully that makes sense. The second type is basically that if you decide to travel, then you will not have coverage for anything relating to the travel advisory, but you'll have coverage for everything else. And that's what this one says. So let's read it together. Any act of terrorism or any medical condition you suffer or contract when an official travel advisory issued by the Canadian government states, avoid all non-essential travel or avoid all travel regarding the country, region, or city of your destination before your effective date. To view the travel advisories, visit the Government of Canada travel site. This exclusion does not apply to claims for an emergency or a medical condition unrelated to the travel advisory. So again, that last sentence there basically says that you'd have coverage for everything except for a medical condition relating to that travel advisory, which again is COVID in this case. So you have to see which type of exclusion your policy has, and we can certainly help you with that, because I know sometimes you feel like you need a Philadelphia lawyer to actually figure out what these exclusions are saying. So we could be happy to help you rather than having to get a Philadelphia lawyer to help you. But I just want to bring to your attention the website it's talking about. So both of those travel advisory exclusions, reference the Government of Canada. So the Government of Canada has a website, and this is the address for the website. And I put in a little screenshot, and it basically shows that avoid all non-essential travel outside of Canada until further notice. That basically means that everywhere is included in this travel advisory. And at this point, we don't actually even know when it's going to be lifted. Okay, so the next question that we get, I need to buy a policy. What coverage is out there to purchase? So that could be in a case where that you guys could be in. Needing to buy a policy. So basically up until July, there were absolutely no options at all to buy. No company in Canada was selling COVID coverage up until July. We were able to find some coverage starting in July. We found a couple of US companies that were offering like COVID coverage. But in September was when we finally had some good snowbird options came available. So, once one company starts to sell COVID coverage, it seems like they all kind of take the plunge. And so by, mid-October, we had about 4 options in total that offer COVID coverage. But not all are created equally. So we want to go through some of the things to watch for as you're looking for COVID coverage. So the first one, I call it the Hyundai version. When I was, just a kid and I was buying my first car, the worst car to buy was called a Hyundai. I think that they've cleaned that up a lot since then, but anyways, you get the point. This is the low model, the cheap model. So basically the cheap model is that the policy might not have an exclusion for COVID, which means that they will cover COVID in that they won't exclude COVID. It's the most basic of the coverages because they don't really allow for anything specific. And it's often up to the full policy maximum. And we'll get into some coverages that do offer some interesting stuff. But before we do that, I'm going to talk about the Chevrolet version. So this, in my mind, is the middle of the road version. So these type of policies have a COVID or a pandemic endorsement, specifically allowing coverage for anything relating to COVID. They may have a few extra perks for you if you need COVID coverage, and possibly a limited maximum, maybe not the full maximum, but at least something. So that would be kind of a middle of the road coverage. Then we have the Cadillac version. So the Cadillac version is the best version of all. This is the best coverage that I've seen that's available out there. And you would be surprised to know that it's not actually that much more expensive than the other coverages. So that's interesting. So let's go through these coverages here. So $5 million of coverage. So including for COVID, there's $5 million of coverage. And then in that policy, if you buy the extra COVID coverage, there is none of this 10-day limit to get home. So if you were in the US on March 13th last year, in 2020, last winter, you will remember that the government said you need to get home, and a lot of insurance companies had a 10-day limit to get home. So you had 10 days to get home before your coverage was affected. So a lot of people were racing toward the border, and it probably wasn't a smart thing to do in terms of all the chaos that ensued on the roads after that, but that's what happened. So if you buy a Cadillac version, you shouldn't have to worry about another 10-day limit to get home. That's assuming they lift the border restrictions sometime before the spring. Coverage for hospital and physician costs due to COVID-19, whether there is a travel advisory in effect at the time of your departure or not. So basically it's saying that whether there's a travel advisory or not, you can get coverage for COVID, hospital, physician, whatever it is that you need if you should contract COVID-19. Plus a few additional benefits. So $100 per day of necessary quarantine at destination. That's outside of hospital quarantine, maximum of $1,400 if you should have to quarantine. That's basically 14 days of quarantining. Up to $500 for perishable goods, groceries, and restaurant meals delivered during your quarantine. And up to $100 for the sum of your taxis to and from a COVID testing center. So these are all little things that you wouldn't think about, but are kind of nice to have if you should contract COVID-19. Access to virtual consultations with a physician. So when you're quarantining at home and you aren't sick enough to go to the hospital, you would have access to see a doctor virtually, and they would monitor your monitor your condition. And of course, this is only offered in the US. Now, this last one here, the automatic extension of the policy rider up to 72 hours following the end of the quarantine. So basically what that means is that if you should contract COVID-19 near the end of your trip, and you end up being required to do a 14-day quarantine while you get over your COVID coverage, your policy is automatically extended for 14 days. So that's the duration of your quarantine plus 3 days to get home afterwards. So again, well thought out and interesting additional benefits, and not as costly as you would think. So a lot of what people ask is, well, what would I have coverage for? And the answer to that, is the best way we can put it is whatever is medically necessary to treat you, including doctor's visits, hospital stays, ICUs, ventilators, etc. So everything that you will need to treat you if you become sick and you medically need to have treatment in a hospital. And I know I've had lots of people ask, well, what about this? And what about that? And what about the other thing? And specific scenarios are very hard to get a straight answer for because of the fact that these are such unprecedented times. We don't have any experience with COVID-19. We don't know what insurance companies are going to cover or not. We actually just got word today that one of our insurance companies, we were asking them about vaccines. So let's say a vaccine comes out while you're down in the US, would they cover you for that? And the answer that they gave us was that they would not be able to cover the cost of the vaccine, if there is a cost, because it's not medically necessary. And if you had a reaction from that vaccine while you're down south, then that wouldn't be covered either. So that's what the answer to that question was. But for the most part, it's hard to know what would happen if there was no room in a hospital, or if you needed to be emergency evacuated back to Canada. Like, all of those things are difficult to answer because of the unprecedented times that we're in. Which brings me to this slide, which is totally us. We miss precedented times. We wish that we still had the answers to all of the questions that our clients ask us, because with COVID, we don't have all the answers on this, unfortunately. Okay, often we get, am I eligible? How do I qualify? So different companies have different eligibility and qualifying criteria. And basically, you could say that the richer the benefits, the tighter the qualifying criteria will be, just as a generality. So we'll go into some of that here. Upfront underwriting. So this is like the questions that an insurance companies ask at the time of application. So that's what I mean when I say upfront underwriting. So first of all, you have all the regular questions about heart and lungs and lung problems and diabetes and stroke and all like gastrointestinal, all those things. You always get asked questions about those, but also companies are asking other information with regards to COVID-19 coverage. So they're asking your destination, where are you traveling to? They're asking about your height and your weight. They're asking if you take any immunosuppressive medication. They're asking if you take corticosteroids. So all of those things apparently have risk factors, are risk factors in relation to COVID-19, and that's why they're asking them up front. So all of those things kind of mix together to create a rate for you based on your age and your trip length. Of course, all the regular questions about all the regular medical problems that you have to answer, and then those things. And all of that creates a rate for you for how much your insurance policy will be to cover you for everything, including COVID. Okay, back-end underwriting. So this is questions at the time of a claim. So we've seen one policy where they ask about quarantining requirements imposed at your destination. So if the destination that you're traveling to has a quarantine requirement, then they say that they have an exclusion that says that they won't pay anything while you're quarantining. And that's a way for the insurance company to like limit their risk at the highest risk places, basically. So we found this article, again, another website here for you about travel restrictions in the US. And so if you were to click on that link, it'll tell you all the quarantining requirements of all the states in the US. And you pretty much can find quarantining requirements anywhere that you, at least where I've Googled, you can find quarantine requirements on the internet so that you know ahead of time. So let's see what that quarantining exclusion looks like here. So this is what the quarantine exclusion in that example looks like. Benefits are not payable under this policy if losses sustained or expenses incurred are the direct or indirect result of any of the following. For any eligible expenses incurred as a result of sickness while under a mandatory or suggested quarantine upon arrival. This exclusion applies if the expenses are directly or indirectly related to the reason for the quarantine. So again, basically, if you are required to quarantine at your destination, then anything relating to that quarantine is not covered during the period of the quarantine. So you want to make sure that the policy doesn't have this if you're going to a place that requires you to quarantine. So that is back-end underwriting is what they call that. So you don't know, unless you know what to ask, you don't know about that at the start when you apply for your insurance, but you'll definitely know if you get COVID-19, you'll find that out. So just a few things to remember. Rules are changing very rapidly. I've never seen in all the years that I've been doing this, things that change so rapidly. We get new providers. We were getting new providers, like weekly there for a while. Manulife is a big provider of insurance in Canada, and their maximum is only $200,000 on their policy. So not very much in terms of coverage for COVID. When that came out, we were really hopeful that the Manulife plan would be a really good plan for us to sell to our clients, but we realized that $200,000, as you guys indicated in your poll, isn't enough for most people. Plus, their prices were quite a bit higher than what we thought they would be. Some of the prices of some of the companies that we're dealing with are changing based on the incident rate at your destination. So I just made a note there that, as the incident rate goes up in the US, the prices are going up as well. So the only way to lock in your price in these instances is to pay for your policy. So if you pay for it now, you get today's price. If you leave it, you don't know what the price will go up to by the time you do pay for it. So it's, if you are thinking of doing that, you can definitely, pay for your policy now, and then if things change or whatever, you get a refund later. We didn't talk a lot actually about the whole shipping your car thing. We've actually seen a number of companies that are willing to ship cars. And if you're interested in that, we can provide that information to you. It can be quite expensive because you have to pay for the shipping of your car as well as the flights down south. But if you are interested in that, we do have information about that. And this is my last slide here. So trip cancellation insurance. I just wanted to mention trip cancellation insurance because trip cancellation insurance used to be something that we sold all the time. But because trip cancellation does not cover people for COVID, it's not really, that's what's on people's mind right now. And basically all insurance companies are considering COVID a known risk, and so they won't provide coverage if you book a trip. You know about COVID, so therefore they call it a known risk and they won't cover you for that. Not to mention though that, most the travel companies like Air Canada and WestJet, they're offering free changes and free cancellation and all that stuff. So you basically don't really need a trip cancellation policy right now because of those things. Also, if you got a credit from a travel supplier in March, if you were on a trip or if you had a trip booked and you had to cancel that trip, you should be able to rebook your trip in the future, and you also should be able to rebook your trip cancellation policy that you had on that trip in the future if you had a trip cancellation policy on that trip and you got a credit on your policy. Sorry, you got a credit on your flights or whatever. So if you didn't get your money back, then you still have a trip that's coming up, so you could reuse your policy on that. So just want to make sure that you're aware of that. And that is all I had for slides. So thank you very much for attending. What is the time? So it's 20, so we have 20 minutes for questions. So I'm going to pass it over to Pam and she's going to go through the questions.
All right. So Patricia Morton wanted to know, she has a current multi-trip annual plan that was extended and she wanted to know what happens to that. So Patricia, I do have your policy information, so I can contact you later or individually to let you know what the clause is in that policy so that you'll understand that. Brenda Dubeck wanted to know if the cost of COVID coverage varied depending on destination. And as your slide indicated, that is yes to some policies. Brian asks, insurance companies typically are adverse to cover risky activities. Is the risk associated with COVID therefore viewed as low?
That's a really good question.
How would you answer that?
How would I answer that? I would say that if you're a snowbird and you're going from, I live in Winnipeg. If you could see all the snow outside, you'd know that. But if you're going from Winnipeg down to wherever, Phoenix or Palm Springs or Texas, wherever you go, basically the riskiest days for you are going to be your travel days because you're isolating here in Canada. you're going to be isolating in your home in the US. So, you know, getting there is probably the riskiest part of your trip. So they're kind of banking on the fact that no one actually wants to get this. So everyone is, whether you're you know, young or old, well, maybe the young people don't care as much, but I can tell you that my age and up for sure, they don't want to get this. And so they are thinking that for the most part, people are going to be isolating, and the risky part is your trip down and back.
All right, and Barb is interested in the car shipping.
So the car shipping. So yes, if you're interested in the car shipping, what we're going to be doing after the presentation is we're going to be sending you just a little bit of another poll. Basically, we would like you to rate the presentation today, and then there'll be an opportunity for you to provide us with your information so that we can send you information on a quote for travel insurance as well as car shipping. So we can get that to you. That's not a problem.
Okay, Lorraine had the same question. John and Dennis or Denise, I'm sorry, Vent, hi. The little reindeer that was popping by earlier. I'll look up your policies and answer your question as well. Patricia Morton asks Lori if we're able to put a list of those links to the airlines and government websites that are available, maybe on our website.
Yeah, you know what, I was kind of thinking that I would send my presentation to you guys, to whoever wanted it. And then the links are all in my presentation, so you'll have all of them right there. So if that works for you, then I will. I know Patricia Morton, I've dealt with her before. Hi, Patricia, and I would be happy to send my presentation to you.
Okay. Brian asks, at what point would a medevac air be sent for you if you had developed COVID? That is a decision that is made by the insurance company and the medical team at the time of the situation and is individually decided. The physician at your location needs to ensure that you are safe to be medevaced. They also have to determine and make sure that there is a bed waiting for you here in Canada so that you can come home safely and have the medical care that you need. The insurance company, of course, will want to do that as soon as possible, but the medical teams in place need to make sure it's safe to do so. Susan asks, if you contracted COVID-19 while you're away, would you have to remain there until you test negative, since airlines won't let you board if you are COVID positive? Susan, yeah, that is a big concern, and that's part of the reason the Cadillac version has that quarantine benefit added, so that some of your expenses are covered while you do go through that quarantine period until you get that negative test result. So, you know, that is one of the reasons that you may want to purchase the Cadillac, but that is entirely possible that you would have to remain at your destination until you got a negative test result.
This is kind of going back to the whole we miss precedented times, because in precedented times we knew all of the answers exactly for all these questions. But you know, the reality is that insurance companies are going to have to make decisions on the fly, and we know that anything medically necessary is covered under your policy, but you know, what that is in your specific situation is determined by your treating medical officers. So it's hard to put an answer to that for sure.
And Brenda, this is lovely. Thank you. Brenda says that they have no questions. They wanted to just say thank you for a very clear and informative session.
Oh, good. Oh, Bonnie Higgins, please send me a copy of your presentation. I know Bonnie, we can do that. I think there's just a late email or question here, Pam.
Yes, I'm just taking a quick look at that. Does Medi Quote work with evacuation services such as SkyMed? We don't have any SkyMed policies. It's not something that we have available. Most of our policies already have a medical evacuation clause directly in the policy. So we're looking at the comprehensive coverage, getting you the best possible coverage, again, for the best possible price, making sure that you have everything that you need. So we don't have just a medical evacuation policy that's on a standalone basis.
I'll just maybe add to that, Pam. We've looked into working with SkyMed in the past, and one of the downsides we thought of working with SkyMed is the fact that it's not an actual insurance company. So, you know, you don't know. I guess the company that operates SkyMed isn't under all of the regulations that regular insurance companies are under, and so it may or may not be a good place to put your money. So we didn't want to be promoting that to our clients. Plus, the other thing is that, you know, even though it's not an insurance company, there is a policy. So I'll do my air quotes here. There is a policy that belongs to that. And if you're not stable, they won't take you in the evacuation. And you can't necessarily get stable unless you go to the hospital. So you're still going to have to pay for that out of your pocket, unless you have a regular insurance policy. And as Pam says, regular insurance policies already have the SkyMed like evacuation services already built in. So, you know, there's no real need for you to buy that policy through SkyMed if you have a regular policy.
We have another question. Someone was asking if we could provide an approximate cost for the Cadillac version, just a ballpark. Well, all of our quotes are based on a lot of factors. We need to know your approximate travel dates. We need to know your age, your health, where you're going. Your destination is factored into that policy. I would highly suggest you just give us a quick call at the office. We'll take all of that information for you and give you that quote. Again, anybody who's worked with us knows that we give you a quote with no obligation. So we'd be able to give you at least the idea of what the cost might be based on some travel dates. And you can always start with the best case scenario. If you want to be gone 90 days and that's too expensive and you decide to shorten to 60 days, you can always do that. The final price is based on your actual travel. John and Dennis want to know if they met either of us at Mesa Market, Lori.
Well, we've both been there, that's for sure.
We have both been there. Can we go back? Roy wants to know, we have a 14-day travel coverage through the Green Shield policy. Does that cover COVID? Green Shields, I'm not entirely.
Yeah, I can answer
Lori.
that, Pam.
Yeah.
Green Shields has told us that they are going to cover COVID. I would definitely suggest that you go onto their website, greenshields.ca, to find out exactly when the parameters of their coverage end. But yeah, I have heard that they are covering COVID. So you should, I don't know if they've sent anything to their subscribers or not, but I have seen it on their website, so you can definitely find out there. I think that's all the questions. And we still have 10 minutes. If anyone else wants to send a question, we're willing to. You've got our attention here. You're definitely able to do that. And if not, then please take our survey. Matt's going to send that survey out to you just following the session today. And if you could provide us your feedback, and then there'll be a spot in there that says if you'd like information about a quote or about the car shipping or whatever, then that will be available. So if not, then I will say thank you very much for attending. We really appreciate all the smiling faces at the that we see here, and look forward to you know, precedented times when we can all travel freely again. So you can leave by clicking the leave button at the bottom right corner of your screen. Thanks for attending again.
John and Dennis, I will send you an email about your policy.
Thank you. Bye-bye, everyone.